Thank you very much for inviting me to be here. I'd like to speak a little bit about Hurricane Sandy, which we all remember quite well from October 29, 2012. And I'd like to go through a little bit about what New York State did. But first, the recovery phases that the National Disaster Response Framework has. There's the short term, which is the immediate basic infrastructure issues. The intermediate, which deals with the return to the critical infrastructure issues, which is mentioned on the slide, which is usually months versus the short term, which is in days. And then the long term, which is the complete redevelopment, and as we just heard from Dr. Redlener, which takes years and probably should be clearly shorter than years. So these are the three phases that the recovery phases that we have at the present time that is defined by the National Disaster Response Framework, and clearly some pictures from the events that transpired at that time. The disaster recovery activities is really a function of the nature and the severity of the incident. The key issue here is that we need to bring people back to their homes in natural disasters, as in hurricanes. You can see that the key is the repatriation of evacuation operations. Sometimes you can't bring them back right away, which raises the issue of shelters, special medical needs shelters. And it's also important to mention, just because of the hurricane, but there are many other situations, snow, ice, tornadoes, et cetera, that we have to be concerned about. And then there are the other threats, which are biological, chemical, or radiological threats, whether a flu pandemic or terrorism or burn issues, particularly in certain parts of the country. We don't have enough burn beds, and even in the New York area, we would have to move across state lines if there were a lot of burn victims. And clearly, at the end, the medical countermeasures involving state stockpiles and strategic plans that are in place. The all hazards issue, there's an incident command system which is key to solving the problems and must be active in recovery and not just response. There's the crisis standards of care. We need to know when to activate and when to stop activating, and who we need to pull into the equation there. And we have to consider those who are the at-risk and special needs populations that are out there, particularly, for example, ventilator-dependent patients, and there are many others. I just bring that up as one example. The short-term recovery activities, these are the activities we need to do. There are surveyor checklists by hospitals, nursing homes, adult care facilities, and each checklist will look a little bit different based on the area that they are focused on. And then we need to restore the basic infrastructure, and that will involve issues of water, food, sometimes immunizations, shelter, obviously, and ultimately recovery organizations. This is one of the issues which we experienced with Sandy, which was the issue that sometimes this gets a little bit confusing because a lot of people come in and they want to help out, they want to volunteer, but sometimes they come to different organizations and they realize that there are enough health professionals there and their skills aren't needed. And other times they end up going somewhere and they don't have the skills that are necessarily needed for that area. And the answer in a lot of ways is to start to train individuals together so that you can be prepared in the times of disaster as they occur. The intermediate term activity, that's the short-term activities. The intermediate term recovery activities are identifying healthcare workers as critical infrastructure personnel. The issues of pharmaceutical availability, this is a big issue, particularly with those with chronic ailments. And then an after-action report and improvement plan process. And that begins in the intermediate phase, but it will continue into the long-term phase. So the after-action reports and improvement plans, as mentioned here, we need to look at the event and see what happened and how do we do hot washes after that to evaluate what could be improved, how do we identify our strengths, our weaknesses, and develop solutions that move forward. And clearly, these will go into long-term recovery activities, which also touch upon funding as well. The funding decisions, I mentioned a little bit about this because it's really dependent on the source, whether it's federal, state, or private. More often than not, it's a combination of those. And how do we decide on these funding? What are the appropriate guidelines we have? What proposals should be put forth? What do we develop? How do we award them? And how do we evaluate the effectiveness of those proposals that have been put out there? And importantly, how do we monitor this in the future? New York State has looked at these short, intermediate, and long-term recovery activities. In the short term, we looked at the e-fine system, and I'm going to mention this, healthcare facility evacuation centers, which is our HEC, and the SNMS, which is special needs medical shelters. In the intermediate, we identify the healthcare workers as the critical infrastructure, as well as issues of pharmaceutical availability. I'll touch upon this. And in the long term, the after-action report, some of the social service block grants, and a couple other issues, and I'll touch on those. On the e-fines issue, this was a system which was required to evaluate the preparedness planning. And what we did, this was being developed prior to Sandy. It was even before Irene, but with Sandy, it really we escalated this. And the whole purpose of here is to have some kind of electronic patient tracking, whether it's web-based or scanners or barcodes. And we developed during the summer of 2013. We tested this recently. The e-fines has been, you may have heard about it. It was trialed at Bellevue. We were doing this to see the effectiveness or to demonstrate it, and we believe this would be very effective for not just storms but for many different areas as well. The HEC, the evacuation center, is primarily for evacuation and repatriation. It's not about other issues. It doesn't support all the ESF 8 activities, and it deals with many different agencies, whether in New York City, or the state, FDNY within the city, and other agencies as well. It was developed in 2005, and it was first activated during Hurricane Irene and Tropical Storm Ali, and then ultimately Hurricane Sandy. The HEC has been, that's just a photograph of the commissioner, the health commissioner from the state, the city, and our state preparedness leader, and that was during Hurricane Sandy. The special needs medical shelters, these are city health assigned. There are 8 of them. The DMATs staffed it with the city, but one of the issues was it was not designed for nursing home residents, and this was a problem, and it was addressed by the city to us that we needed to be sure that we didn't end up in a situation where a lot was asked of individuals in these special needs shelters to take care of people that they are really not capable, not necessarily capable of taking care of, but don't have enough staff to take care of at that time. Healthcare workers, it was important to identify who are the critical infrastructure personnel, and also how we can get those people to where they need to be, including how do you get fuel, and what are the special ways to make sure that individuals who are tracking or restricting a flow of individuals, of health workers, or anyone for that matter, into an area, know that these are people who are first responders or people necessary for healthcare delivery for those who have been compromised by a storm or any kind of disaster. Pharmaceutical availability, we had CVS Mobile Pharmacy, we have the EPAP, which I'll talk about, prescription system, FQHCs, mobile van, and the door knock mission. So with regards to the CVS, CVS deployed a van from Ohio, which was the closest van that they had available. We set it up in the Rockaways, and the reason for the Rockaways was primarily because it was the area that was the most in need and didn't have a pharmacy available. The EPAP is the Emergency Prescription Assistance Program, and it's designed for the uninsured. It's a federal program, and it allows a person to go to a mobile pharmacy, or a regular pharmacy for that matter, in the aftermath of a storm to get the prescriptions they need. It was first used during Hurricane Sandy, and about $1.2 million was spent on prescriptions at that time. The Federal Qualified Health Centers, mobile vans, there were 9 vans that were deployed from other counties in the state, brought down to the city. They were daily deployment schedules developed based on what was needed, and there were primary care and limited pharmacies as well available. This is an picture of one of the mobile vans. That's our Commissioner of Health, Dr. Shah, in the front there. And the door knock mission was primarily used in large apartment buildings, given clearly this is something which you'd see in a large city, or any city for that matter, and definitely in New York. We matched people up with the various agencies, and they would knock on the doors to check on individuals. It was a joint task force between the City Health Department, State, FEMA, the Police Department, and others. And there were wellness checks to make sure that people had their needs, the supplies, blankets, whatever else was available. And many of the National Guard ran up and down to local pharmacies to get the prescriptions filled for those who said that they were out of their medicines at the time. The mobile medical facilities was in New Jersey, Mobile Satellite Emergency Department, which was brought to Long Beach, New York, where they were needed, and federal medical stations as well. There was a mobile satellite emergency department was set up, and I'll show you a picture of that, which was for emergency care, x-rays as well, that was brought in, and this is a picture of one of those that was set up in a parking lot at the time of the storm. The federal medical stations, there was a 250-bed facility. This was needed to identify. First, it was critical to identify which building, where we're going to set it up. We had one in New York City, one in New York State, and we helped equip the special needs medical shelters because there was a lot of need for that. The Department of Health still has a full FMS available, and we have that on Long Island. This is a picture of one of the, this is a schematic of how the FMS is set up. This is a picture of the actual FMS as they were unloading it, and this is a picture of it once it was set up and ready for operation and available. And we had this at the time of Hurricane Sandy. And then the after-action reports and improvement plans, we conducted 17 hot washes, which involved all the different teams and the responses, and it was conducted between December of 2012 and April of 2013, and we published that report in December of 2013. That's the report that we have, and we'd be glad to share that with the committee as necessary. The lessons learned from the report, and I'll just finish up with this, was that the need for a patient tracking system, the emergency preparedness personnel infrastructure I mentioned about making sure people are available, the healthcare workers are critical to the infrastructure, and also the shelter-in-place need, because there was a concern that some of the people shelter-in-place, obviously, if they didn't have generators, that would be a problem. The healthcare facility construction issue came about because of the damage. We put a moratorium on new and major renovation projects that was established in May of 2013. This is a picture of just sort of the healthcare facilities, and this is the different zones. And we've had many activities and discussions subsequent to Hurricane Sandy to discuss the storm and what to do in the future. And lastly, the social service block grant. The federal money went to social service block grants, which was dedicated to Sandy relief. The e-fines funding was actually the tracking system I mentioned was also part of the social services block grant, and the HEC data application to combine all available data into one system. The purpose here is to be able to have e-fines, the medical examiner's office, the electronic systems, all in one area so that we wouldn't be doubling back and reproducing, having duplicative efforts on the part of everyone involved. I want to be careful of the time, so I'm going to skip over this one. Just mention a little bit that there's a public health and health planning committee which sort of overlooks a lot of the issues that are focused on what the Department of Health has done for Hurricane Sandy. And that report is also available, which I can provide to you. And the last thing I'll mention is what the report came up with. There were 8 recommendations. One was about regulatory change to update to a 500-year crest level, about how, in case there was a storm in the future, obviously to look at it from the standpoint of 500 years. Mitigation measures to apply this to all new facilities, to require accessibility of patient information, to have voluntary adoption of the best practices, to lift the current health facility construction moratorium, which I just mentioned, and also to emphasize the role of the different agencies that are out there for this. And the resources, obviously, National Disaster Recovery Framework, state recovery plans, and the concept of operation plans that are out there. I know this is a lot of information. I wanted to cover this. If there are questions, I'd be glad to answer it. We have these reports, and we can provide them to the committee. Thank you.
Thank you very much. We'll come back and do the questions. Lauren, I would hope that maybe we might be able to get that last page of recommendations, just a copy of that one page and shoot it around. That would be useful. I couldn't write that fast. Bruce, do you know that you're the Director of Public Health Preparedness at the Texas Department of State Health Services?
Yes, sir. I've been told that.
And in that regard, we're happy to have you. Thanks a lot, Bruce.
Thank you. It's good to be